Presentation of this ViewFinder episode is locally supported by UC Davis Health System.
Breathless. Could you imagine not being able to breathe? I'm Jennifer Whitney. For the next half hour, we'll explore the growing epidemic of asthma here in the Valley. The problem is year-round. Our summers may be dreamy, but poor air quality coupled with hot temperatures can turn those months into a nightmare for someone with asthma. Fall brings beautiful colors and cooler weather. The changing season also creates moisture and dampness. Adults and children are forced to stay indoors a little more. And with that, sometimes comes exposure to molds and dust mites. Both can be serious triggers for asthma sufferers. Asthma threatens a person's ability to take in oxygen. Winter escorts in the wind, the rain, and the flu. Things that may not cause serious problems for the rest of us can provoke airways to constrict in people with asthma, making it difficult to breathe. Risk factors can include something as simple as cold air. As days grow longer and temperatures warm up, grasses are greening and flowers are blooming. But with that beauty comes a price. Spring is by far the worst season of the year for allergies, and allergies can wreak havoc for a person with asthma, causing wheezing, shortness of breath, and rapid heartbeat. The symptoms can be frightening, devastating, even life-threatening.
I've suffered from pneumonia 3 or 4 times.
19-year-old Jameson Mitchell has suffered from asthma all of his life.
There's a lot of difficulty breathing. An asthma attack is really a really bad thing. It's almost, sometimes you can't breathe.
For Jameson, the doctor's office is a familiar place.
My son has a lifelong challenge. It's called asthma. He's been dealing with it since he's a little boy. He's had difficulties breathing. Certain times of year he has difficulty because of pollens or things that he's allergic to. When he was a little boy, I stayed home with him for a month because he had pneumonia.
This was Jameson 11 years ago.
My lungs get clogged up and it's hard to breathe out of your mouth and your nose.
I had to take him into the doctor. I had to give him nebulizer treatments and his medication, and it was a process. It was a good thing I was there. You needed, round-the-clock caretaker.
Tests early on showed Jameson was highly allergic to grasses, trees, and pollen. In this valley, allergies are one of the most common causes of asthma. For years, Jameson got allergy shots.
I've had my tonsils and my adenoids taken out, and I've had my ears tubed as well.
How are you today?
Not too good.
Okay, what's going on today?
Dr. Ron Sokolov is Jameson's primary care physician.
I think he either picked up a virus, he is being treated for a bacterial infection, so one of the two organisms has invaded his bronchial tubes, has gotten into the lungs, deep breath, and now it's probably triggered a low level of his asthma that caused his wheezing, certainly is causing the fever.
For many asthmatics, viral or bacterial infections are other big triggers.
I feel that it's not fair. It's not fair, that he has to put up with this. He has to deal with this. He has this lifelong problem. And I don't know how it's going to affect him when he gets older. He caught a little virus, and he ended up on heavy-duty antibiotics. He's been sick for over a week. It could have turned into pneumonia. He's coughing up blood. I caught a little virus, the same virus last week. I got a little headache. I got over it. He's not able to do that. It's not fair.
I'm really concerned about my asthmatic population. So the first thing I'd like them to do in the fall is get that flu shot.
For years, Jameson saw pediatric pulmonologist and allergist Dr. Bradley Chips.
Children with asthma will have long periods where they're asymptomatic, but during the time of the year when viral infections are prevalent, they're at higher risk for exacerbation.
Asthma is on the rise and considered an epidemic. It's a long-term health condition that causes air passages in the lungs to become inflamed, narrowed, even blocked. Patients say it's like breathing through a straw. Symptoms include coughing, chest tightness, wheezing, shortness of breath, and difficulty breathing. And though rare, it can be deadly. The valley we live in is like a bowl that collects pollutants and allergens that just sit. While the valley is beautiful, the air we breathe isn't always good for us. Pollution also causes asthma, so we know asthma is triggered by dirty air, allergens, and viral infections.
80% of asthma starts before 5 years of age, and invariably starts with viral infections that occur early. Well, what causes asthma to become persistent is the development of allergy. One tries to make a decision about allergy based upon the patient's history,
He'll cough for a day and then the next day he won't cough.
the correlation between exposure to known allergens and increase in symptoms. And that can be verified by doing either a blood test or skin tests, which are done in the office.
You're doing so, what a brave boy.
Little Camden and Carson are being skin tested for allergies. An allergen extract is applied to a tiny scratch or prick of the skin. The red bumps are an indication of allergic reactions.
If patients did not develop allergy before age 8, they had a 90% chance of outgrowing their viral-induced wheezing by the time they reach puberty.
Breathe, just perfect.
So it is a very important concept to keep in mind, and also reinforces why early allergy evaluation may be very helpful in A, treatment, and B, prognosticating about what's going to happen.
Sarah?
Allergy shots, also called immunotherapy, are sometimes prescribed to help increase a person's tolerance to substances that cause allergy symptoms. Initially, shots are given once or twice a week for several months. 80-year-old Marilyn Bingham relies on a variety of medications, including inhalers, to keep her asthma in check.
I've had asthma since I was probably 10. When I went through puberty, I got it bad.
Most Americans who have asthma in the United States, they are first recognized to have this condition as children, and then they grow up, they become adults, but they never ever really get rid of it because, as we know, asthma is a genetic disorder.
In kids, it's much more prevalent in boys than girls, about 2 to 1. But during the teenage years, it becomes much more prevalent in girls. In our severe asthma clinic, it's 80% women.
Well, I've been under control with my asthma for many years.
Doctors say hormonal influences play a role in asthma and that it's an area of active research.
Does that hurt you at all, dear?
Meanwhile, scientists have long known asthma is hereditary. A person with a parent with asthma is 3 to 6 times more at risk. Other triggers for asthma include tobacco smoke, cleaning products, cold air, viral infections, air pollution, and allergens, as we've already mentioned. Add to that list heartburn. Yes, heartburn. In fact, heartburn can be the culprit in difficult-to-treat cases of asthma. Though not the case for Marilyn, she's had her own challenges with asthma from the time she was a young woman.
Easy when you don't have it, terrible when you do. You lose all your strength and all your energy and your love of life if you're struggling to get a breath.
There are an array of treatments, drug treatments, but more important than drug treatment is asthma education.
Make sure that you open the thumb notch, which exposes the mouthpiece here.
We do know that the immune system in asthma is actually in overdrive. It's very, very active. In fact, it's creating antibodies against allergens. So there's a particular antibody which is very elevated in many patients who have allergic or extrinsic asthma.
Big breath in, blast it out as hard and as fast as you can.
In the doctor's office, Marilyn's lung function is measured and she's given instructions on how to properly use her medications.
While I'm trying to bring out the therapeutic benefits for a particular patient. But every patient is different.
Seeing a doctor and controlling asthma prevents emergency room visits and hospitalizations. That's the goal. But access to health care is sometimes a barrier.
In this country, we have learned that health is really related to wealth. And the wealthier you are, actually, the healthier you are, and the more likely you are to have a longer lifespan.
Sacramento County Health Officer Dr. Glenna Trochet says there's no question poverty and asthma are linked.
children in minority groups who tend to be in poverty more often tend to have a higher incidence of asthma, and unfortunately also a higher incidence of emergency room visits and hospitalizations for asthma.
Anna Cornelius is barely getting by financially.
I have a job that pays only for room and board, transitional living. I am the program director there, but it's only room and board.
Anna does not have health insurance, but she does have children.
Twins. I have twins, Serenity and Destiny, and they are 5 years old, and they both have asthma.
The girls are being raised by their mom and grandmother, Ruby.
It's hard for Destiny sometimes when she get sick to breathe. She's kind of like weed-like, make a sign. And this time she didn't do it though. She had a bad fever. But one time she had it so bad I drove her to the hospital. I got in the car and I didn't think she was gonna make it, but I just kept driving.
African American children, their rate of hospitalization is 250% higher, so that's 2.5 times higher than that of other children. And their death rate from asthma is 500% higher. And these are the statistics from the U.S. Department of Health and Human Services, the Office of Minority Health.
Poverty, lack of education, and poor access to health care are a big part of the problem.
I would love to be better educated as to the things that can help prevent asthma attacks. Educate me. Yeah, educate me.
That's exactly what Aziza Davis Goins is trying to do. She heads up the Sacramento Black Chamber of Commerce.
There is such a disparity in healthcare. You will find that these children that are suffering with asthma are living in deplorable conditions. There's mold in the houses, there's smoking in the houses, there's particles in the air, horrible carpeting.
Homes tend to have triggers such as dust mites, and this is no reflection on housekeeping practices. If you live in an urban area, your home is going to have dust mites. It's also going to have cockroaches. And these are definite environmental triggers for susceptible people for asthma and asthma attacks.
You know, as pretty as these are,
okay,
they're probably full of dust, full of mites. And I don't know if that's a really good thing for the girls.
Right.
Stuffed animals are great places for dust mites to hide. Washing all blankets and sheets on your bed every week will minimize dust mites. Keeping your kitchen as clean as you possibly can, not leaving any food out in any way, can minimize the amount of cockroaches that may come that you will never see, but they're there.
While Mom Anna does not smoke inside or around her children, she has yet to kick the habit, although she's working on it.
Because I stopped smoking, and the smell of a cigarette would bother me. But then when I get a little stressed or overwhelmed, I'll still take a drag off the cigarette.
Anna takes her girls to a county clinic where their asthma was recently diagnosed, but she's worried about the future.
Clinics are closing all over this area like crazy. The safety nets that were available for these children no longer exists in many of the neighborhoods. It's a very, very sad situation, deplorable.
From 19-year-old Jamison Mitchell to 80-year-old Marilyn Bingham to 5-year-old twins Destiny and Serenity, asthma does not discriminate.
What to do, you don't give up. You keep on going, you don't give up.
Persistence pays off. Sacramento swimmer and 3-time Olympic gold medalist Debbie Meyer can attest to that. She also has asthma.
These are the gold medals I won in the 1968 Olympics in Mexico City for the 200, 400, and 800 meters freestyle. So lots of memories, lots of hard work, lots of dedication, determination, desire.
Swimming remains her life passion, and she now runs a swim school in Carmichael, a suburb of Sacramento.
My asthma is hereditary. And unfortunately, my son picked it up from me, and I picked it up from my mom and my dad. Swimming, I think, is one of the best sports anybody can do. And I think it's mainly because the water, when your lungs are underwater, it equalizes the pressure in the lungs.
Many people who exercise do notice asthmatic symptoms. And when they've studied elite athletes, particularly Olympic athletes, for example, depending on the test that they use to diagnose asthma, they report prevalence rates up to 30–35%. But we think that the primary irritants for athletes are breathing in a lot of dry, cold air through their mouth.
And, you know, if it's a bad air day, you know, use common sense. You don't go outside and exercise. Even healthy people don't do that or shouldn't do that.
Debbie's gold medals are an inspiration to everyone who sees and touches them.
It was 3 wonderful moments, and I think the best moment out of the 3 was after I won, and I'm gonna cry. After I won the 800-meter freestyle, I got off the block and I went over and I gave the medal to Sherm, my coach.
Debbie is speaking of longtime Sacramento Olympic coach Sherm Shavor. She says he helped her tackle asthma and become a winner. In turn, that wisdom she generously shares with others.
Don't give up. Use your medication. If they say to use it, use it. Just like I tell anybody, set a goal, work to achieve it. Don't give up. I lead an extraordinary life.
Rick Kizer also refuses to let asthma hold him back.
It can be very frustrating. That's probably a good word for the last couple of years, just frustrating.
He has what's called exercise-induced asthma.
Exercise-induced asthma is asthma that comes on when people are exerting their heart or lungs. For me, I was diagnosed when I was around 12 years old, 11 or 12, and then didn't really have any problems until about 2 years ago. I'd use my inhaler occasionally, but 2 years ago I was hospitalized with pneumonia.
Rick is an athlete and avid cyclist.
So over the last couple of years I've had probably 10 to 15 different pneumonias. I've got lots of triggers. Allergens, the valley essentially is one big trigger for me. Cold weather seems to be another one, and sometimes the extreme heat can be a trigger for me. But usually it's people with colds and those kinds of things really bother me.
Asthma and chronic illness forced Rick to seek help. He was fortunate to find Dr. Nick Kenyon, who specializes in exercise-induced asthma.
Your asthma symptoms seem to be under control.
They have been for the most part.
Patients who have exercise-induced asthma, or another term we use is exercise-induced bronchospasm, meaning twitchy airways, they'll notice symptoms towards the end of their exercise, and usually a few minutes after exercise, and that's when they'll have problems with cough, difficulty getting breathing in, chest tightness, a little bit of chest pain. That will often go away over a period of time. Exercise-induced bronchospasm is a condition that definitely benefits from treatment.
Some nice deep breaths for me, Rick, if you can.
And they are treated with inhalers, usually. It's also important that patients who do have these exercise-induced symptoms get evaluated by a doctor to see if they actually have chronic asthma, be it related to allergies, virus infections, things like that, because certainly persistent or chronic asthma should be treated with inhaled steroids over a long period to prevent some of the long-term complications.
For me, exercise is one of my big outlets.
Rick hops on his bike and rides every chance he gets.
It's been a tough couple of years. You know, it gets to the point where one day you can ride 50 miles on your bike and the next day you can't even take a shower. So it's been a long time.
Rick is right now involved in a clinical trial that we're doing where we're looking for a specific subpopulation of asthmatics who may benefit from omega-3 fatty acids.
I'm on a fish oil study with Dr. Kenyon at UC Davis, and I take 5 horse pills. And I'm on a blind study, and so I don't know if I'm on a placebo right now or if I'm on fish oil.
And Rick is quite the athlete. He's a cyclist and soccer player, among many other things, and we're interested to see which group of asthmatics may benefit from a fairly simple intervention.
Rick faithfully takes his medications, fish oil included, and is, for the most part, feeling pretty darn good these days.
I love going fast.
The air we breathe, what's it doing to us? Researchers are trying to figure that out. Studies are currently underway to determine what kind of toll pollution is taking on our lungs and asthma. Ground level or bad ozone. It's a familiar term, but what does it mean?
Ozone is a very reactive molecule that's formed in the atmosphere by sunlight hitting smog and creating out of the smog this very reactive molecule called ozone.
At ground level, ozone is extremely harmful, especially in summer months when strong sunlight and hot weather combine and severely pollute the air we breathe. Again, we live in a valley that collects pollution, pollen, and other irritants that can trigger asthma. Dr. Dallas Hyde is the director of the California National Primate Research Center and a professor at the UC Davis School of Veterinary Medicine.
My hope is that we can find a therapeutic intervention to counteract the development of ozone and allergen early in life to spare children the suffering that they go through with asthma.
You're doing a great job, sweetheart.
Because I believe that sets them up for a lifetime of suffering. I think what we're learning is why asthma is increasing exponentially in our population, and certainly in California, where asthma is having a great toll, especially on children.
The Primate Center is located in Davis and is the only one in all of California. There, Dr. Hyde is doing groundbreaking research with rhesus monkeys to better understand the relationship between air pollution, allergies, and asthma.
Many of the animals at our center that are out in the breeding corrals, some of them will live their entire lifespan there, and they will live up to probably the early 30s. In the wild, they seldom live past 18 years of age. What we have found is that simply ambient levels of ozone that exceed the National Air Quality Standard is adequate to cause injury in the lung. And it's that injury in the lung that sets up a situation where an allergen has greater access to cause an immune response that then becomes an allergic response in the airways that damages the lung. And normally when you think of asthma, you think of something that's reversible. What we are seeing with ozone exposure is that we're getting abnormal airway growth in infants that then doesn't appear to be reversible. So the air we breathe indeed is playing a role. I think the future is in our hands, and it's a great responsibility.
At Breathe California of Sacramento Immigrant Trails, clean air and healthy lungs are their #1 focus.
We have some of the worst air quality in the nation. In fact, every year, if you look at the top 10 worst, usually 5 or 6 of them are cities that range up and down our valley. So certainly when it comes to the link between air pollution and asthma, we have a very challenging problem ahead of us. And it shows in the prevalence rates. Just in Sacramento County, for young people, our prevalence of asthma is about 20%, where if you look at the entire state, it's about 18%.
Exhaust fumes, traffic, smoking, refineries, there's no question air pollution is contributing to the growing incidence of asthma in our valley. Staying indoors during bad air days as much as possible is important.
And the other thing that you can do, and that I recommend for everybody to do, is sign up for the air alerts. You can get those through the Sacramento Metropolitan Air Quality Management District. You can go to sparetheair.org and you will start getting alerts to your email, to your cell phone, to your pager, however you want to receive that information.
Education. That's the mission of Camp Arroyo in Livermore. It's an asthma camp for kids, started by Al Brown.
There are over 20 million people in the United States that have asthma, and lots of kids end up in the hospital.
The camp is free of charge and offers swimming, horseback riding, and marshmallow roasts.
The goal of the camp is to prevent emergency room visits and hospital stays. The goal is to try to give the child enough education to manage their asthma. It's sort of a preventative program.
All right, Jameson, how are you doing today, bud? All right, my man, you ready to get started?
Learning to manage asthma returns a person's quality of life.
The martial arts always has been a noble art.
Given that Jameson is highly allergic to grasses, trees, and pollen, karate is an ideal art form for him because it's indoors.
It's about personal development, growing oneself.
Remember, just a few short weeks ago, Jameson was very sick and struggling with his asthma. With medications and rest, he's once again training.
Of course, we're short-winded when we push ourselves, but it's amazing to see how strong he has become as far as his respiratory system is.
Jameson is learning to conquer his asthma with the spirit of a peaceful warrior.
He is a very self-disciplined person, but he comes to us because he wants guidance, he wants coaching, he wants to improve himself, and I'm very pleased to have him as a student.
We have hundreds of beautiful days here in the Valley. Don't let a little pollen or asthma steal the moment. Educate yourself. And if you or a family member has asthma, or you even suspect you might, seek medical help. After all, life is to be lived to the fullest.
To order a DVD copy of this program, call 888-814-3923 or visit kvie.org/viewfinder.
Presentation of this ViewFinder episode is locally supported by UC Davis Health System.